Hello everyone, my name is Antoinette Simofranca and I'm here to do a physical assessment on my patient, and the system that we're going to focus on today is going to be HENT, respiratory and cardiovascular systems. I already washed my hands and I'm going to introduce myself to the patient. Hello, my name is Antoinette. I'm going to be your provider today. Can you please tell me your name and your birthday?
My name is Adelisa Flores. My birthday is November 23, 1964.
Perfect. Patient is alert and oriented. She is in good mood. She is well dressed. Her hygiene is perfect. Her skin is consistent with her ethnicity. Now I'm gonna start assessing the skin. She has sunspots noted in the face and also in her arms on the left and on the right side. Do you expose yourself to the sun every day?
Every day.
Do you use sunscreens?
Not always.
It is recommended that we use sunscreens, especially with the SPF of 30 and higher, because that will help you prevent from getting exposed to the sun's radiation, which will increase your risk for skin cancer. Okay. All right, I'm going to start my inspection with the head. Okay, do you feel pain when I touch your head?
No.
All right. Her head is normal cephalic. It's symmetric. There's no visible lesions and no palpable lesions and bumps in the head. Normal hair pull test. And now I'm gonna have you smile. Can you frown? Raise your eyebrows against mine. Okay, her cranial nerve 5 and 7 is intact. And can you feel me touching you here?
Yes.
Can you feel me touching you
Yes.
here? Cranial nerve 5 for facial sensation is also intact. Can you bite down? Can you bite down? Perfect. The masseter is also intact. And now we're going to check the eyes for corneal reflex. First, I'm going to shine a light on your eyes and just look straight ahead, okay? Do you normally wear glasses?
Yes.
Okay, we're going to keep it on for this test. Look straight ahead. There is normal corneal light reflex and it's symmetric on both eyes. Now I'm going to have you cover your one eye and I'm going to shine a light as well and do the same thing on the other side. All right. There's no lateral movements of the cornea when that test was done. Now I'm going to test for extraocular eye movements of cranial 3, 4, and 6. So with your eyes, just follow my finger and don't move your head. Okay. There is conjugate movement of both eyes, normal convergence, and cranial nerves 3, 4, and 6 are intact. Now I'm going to remove your glasses and I'm going to inspect your eyes. Open. Close your eyes. Open. All right. Look up, look down. All right. There is normal eye alignment. The eyes are symmetrical. Lid closure completed without difficulty. Normal hair distribution in the eyelids. There is no redness noted in the lacrimal apparatus. Her conjunctiva is pink and moist. The sclera is pink and moist, and there is no blood vessel congestion. Her pupils are equal, round, and reactive to light. And now I'm gonna check for the fundoscopic exam of the eye. So normally this test is done with the room darkened, but for video purposes, we're just gonna keep the lights on and pretend that it's dark. And I'm gonna shine a light on the patient's eye by looking through her right eye and with the right reflection. Okay, just look straight ahead. Look straight ahead. All right. Fundoscopic exam for her eyes, as there is a red light reflex. The red reflex is visible. No retinal background hemorrhages, and the retinal vessels were noted. Next, we're gonna go to the ears. First, I'm gonna inspect the ears, the tragus and the pinna on both sides. The ears are normal in position. It's symmetric, and there's no palpable lesions and nodules visible in her ear. The pinna and the tragus are intact on both sides. Now I'm going to use my otoscope to inspect the canal and the tympanic membrane. So ear canal is patent. Tympanic membrane is pearly gray, semi-transparent, and no perforations noted on the left side. I'm gonna do the same thing on the right side. Ear canal is patent. Tympanic membrane is pearly gray, semi-transparent, and there's no perforations noted. Now I'm gonna perform the Weber test. So let me know if you don't hear the vibrations or if you hear it more prominent on one side.
Okay.
Tell me when you
I hear it.
Can tell me when you can no longer hear it.
No more.
Same thing with the Rhine test. Can you hear the vibrations?
Yes.
Tell me when you can no longer hear the vibrations.
Yes.
Can you hear the
Yeah.
vibrations? Tell me when you can no longer hear the vibrations.
Yes.
Okay. Her hearing is intact. Or I'm gonna do the whisper test. 4. Say 4. 7.
7.
Whisper test is also normal. Now we're gonna go to the nose. Shine a light on your nose. Okay. I'm gonna have you smell. Can you close your eyes for me? Can you smell this?
Yes.
What did you smell?
Coffee.
All right. Her cranial nerve number 1 is intact, which is the sense of smell. Her nose is symmetric. The nose bridge are firm. The nasal cavity is patent. It's free of blockage. There's no polyps. There's no blockages and polyps. I said that. The nasal septum is continuous and there's no deviations. The turbinates are dark pink, moist, and no lesions or swelling was noted. Now we're gonna go to the mouth. Obviously, the patient can speak clearly with symmetrical movement of her lips. There is no lesions noted around the mouth and lips are pink. Now I'm gonna have you open your mouth, stick out your tongue, move your tongue up and down, and then push it against your cheeks, push it against your cheek, open your mouth, say ah, louder. Okay, perfect. You can close your mouth now. Thank you so much. So there's no prominent odor that was noted in her mouth. The buccal mucosa and the gums were pink and moist. There's no lesions. No trauma was noted. The teeth were white and evenly spaced. Her tongue was midline. Cranial nerve 12 is intact since she was able to move her tongue up and down and against the cheeks. Her uvula was midline and rise symmetrically. Now I'm gonna have to check for gag reflex, which I'm just gonna pretend so I don't gag the patient. This is to test for cranial nerve 9 and 10. Open your mouth and put the tongue depressor 1/3 to the tongue, and the patient should be able to gag. Next, I'm gonna go down to the neck. So there's no visible lesions or nodules in the neck. The lymph nodes are non-tender bilaterally. Trachea is midline. And also the thyroid, it's non-palpable. I'm gonna palpate for her carotid. It's on the same side. No thrills. And then I'm gonna listen to her carotid. So I auscultated both her carotid and thyroid, and there was no thrills and no bruits heard. I'm gonna check for cranial nerve number 11. So can you turn your head left and right, up and down, and push your shoulders against my hands and shrug your shoulders. So cranial nerve number 11 is intact. Now we're gonna go down to the posterior chest. So I'm gonna inspect her back for crackles. Okay, take a deep breath. Exhale. Say 99.
99.
Perfect. Thoracic expansion. There is thoracic expansion. There is tactile fremitus. And now I'm gonna percuss. And now I'm gonna auscultate the back. So all lung fields are clear. Bilaterally, there's no adventitious sounds that were heard. Now I'm gonna have to let the patient face me to check for the anterior lungs. So first I'm gonna feel for crackles. Take a deep breath. There is normal thoracic expansion, and I'm gonna palpate for the apical pulse. And then I'm gonna listen. So same thing, all lung fields are clear bilaterally in the anterior part. Now I'm gonna have to let the patient lay down. And I'm gonna check for jugular vein distension. Normally they are supposed to sit in a 45-degree angle, and I'm gonna check the neck for I'm gonna check the jugular vein if it's prominent. There is no visible jugular vein distension noted for the patient. And now I'm gonna palpate the patient for her I already did a carotid. Now I'm gonna look for the aortic, the renal, the iliac, the femoral, the popliteal, there's posterior tibia, and the dorsalis pedis pulses. So for the aorta, I'm just gonna have you cover and raise your, okay, aorta, renal, iliac, femoral, and then the popliteal, the posterior tibia, and the dorsalis pedis, which you can barely see. And also I'm gonna check for caprifo. It is less than 3 seconds, and also I'm gonna do it on the foot. It's less than 3 seconds. And now I am going to auscultate for the arteries. So there is no thrill and bruits on the abdominal, the aortic, and the renal and the iliac arteries. Now I'm going to auscultate for auscultate her chest and listen for heart sounds. So her chest are there's no S1 and S2 is audible. There's no murmurs or clicks, and there is no deviation of the primary the PMI. So that concludes my health assessment for this patient. Thank you so much.